Hi there, my name is Samantha Mayo, and I'm a nurse researcher from the University of Toronto and the Princess Margaret Cancer Centre in Toronto, Canada. In my research, I focus on understanding the impacts of cancer and its treatment on the quality of life of patients with blood cancers and their families. Currently, with generous support from the LLSC, my team is studying the factors that influence quality of life among patients with lymphoma treated with stem cell transplant and CAR T-cell therapy. The findings from our study, as well as findings from other quality of life research, will really help us determine and deliver the types of appropriate services needed to support patients and their families after the completion of treatment. I'd like to acknowledge Steele Auto Group for their tremendous support of the work of the LLSC. I understand you've been supporting LLSC for the past 10 years and have been a significant contributor to their work. I thank you as a researcher who's benefited from the research funding through LLSC for this generous contribution. I'd like to acknowledge and thank you for representing your members, representing your community, and supporting the blood cancer community as a whole.
Hi everyone, my name is Natasha Szuber. I'm a hematologist-oncologist from Montreal, Quebec, Canada. I'm interested in a group of diseases called myeloproliferative neoplasms. These are chronic blood cancers. They represent a pre-leukemic state, and patients are faced with many different complications of disease, but also a lifelong symptom burden that can lead to severe fatigue, physical disability, psychological distress, and impaired quality of life. What's really interesting with these diseases is that we're finding more and more prevalence of these diseases in younger patients. However, our current approach to managing is really a one-size-fits-all approach, which really isn't working for our young patients. We want to document the disease experience, how they're going through their disease, how they perceive it, what we can do to better accompany them and address their needs. And ultimately, we're looking at developing a quality of life discussion guide and toolkit that will help guide care for these young patients, help the patients support themselves and each other, and also help the caregivers better support and accompany the patients and ultimately improve patient care and the disease experience. The impact stands to be really, really significant. We really want to thank the Steele Auto Group for funding this truly inspiring work. Our patients are also ultimately so grateful to you and have already expressed how grateful they are that we're finally sort of listening and addressing their needs. We recognize that the Steele Auto Group has been supporting the LLSC for 10 years now, and that time has raised a truly impressive $1.7 million for the blood cancer community. And I can't wait to see the far-reaching impact of this particular project that you've helped fund. So thank you so much to LLSC and the Steele Auto Group.